Hi you guys, it is October 7th, 2018, and I want to do a little check-in. In a couple minutes I'm going to do another video with my daughter because I wanted to introduce her to everybody because she has her big day tomorrow. But before I do that, I kind of wanted to check in with you guys on just my little update because I kind of have some things going on that I wanted to share and to keep you guys in the loop because you guys have such great suggestions and so much encouragement, and I kind of need that a little bit right now. So my name is Jennifer. Sorry, I have a little tear in my eye. My name is Jennifer. I had VSG surgery, which is a vertical sleeve gastrectomy surgery, which is a weight loss surgery, on January 23rd, 2017. My highest weight ever was 261 pounds. My surgery weight was 250. The lowest weight that I have seen since surgery was 162. That was a couple months ago. I am now 1 year and 8.5 months post-op, I think. So like I said, my lowest weight I'd seen was 162. I had a regain of about 11 pounds. I am now back down to 170 from my regain weight was 172. Maybe 173. But so I wanted to talk about two things today. One, sort of a health update, because I do have some health challenges that I've spoken to I've spoken about in the past, but I've had some doctor's appointments, and so I have some new news about that. But I also want to share with you guys what I'm doing to conquer this regain and how to get back on track despite the health issues. So the first thing is the health stuff, just to get that out of the way, because it just sucks. So you guys know that I'm 44 years old. I am 5'4", and I've had a lot of health challenges. And one of the things that I have that has plagued me since I was about 30 years old, or maybe a little bit later than that, is I have a really severe case of endometriosis. Now, because of the endometriosis, I ended up having a total hysterectomy about 7 or 8 years ago. I also have a autoimmune disease called Graves' disease, which is an overactive thyroid. Well, apparently, when you put those two things together, they both equal possible osteoporosis, because apparently having a high thyroid level, it stops the body's ability to absorb calcium, which I actually had no idea about until just very recently. And then with having the hysterectomy, my body isn't producing estrogen, and I'm not on replacement therapy because of my endometriosis, because endometriosis is fed by estrogen, and so I cannot take any estrogen. So that causes bone loss. So my thyroid disease causes my body not to be able to absorb calcium into my bones, and then the hysterectomy and the low estrogen is causing bone loss. And so I am at an accelerated rate of bone loss right now for my age, and I just had an additional extra blood work, and it's pretty severe. So I have what's considered severe osteoporosis, except for the fact that because I'm 44, it's not possible for me to have osteoporosis because of my age and the insurance coding. So I'm technically someone with low bone density because of my age. And I was talking to my doctor, and I said, so if I was 45, I would have osteoporosis. I'd have severe osteoporosis, but because I'm 44, I can technically not have that. I technically only have low bone density, which makes no sense whatsoever. But so what I'm doing is I am not taking this lying down. I am researching like crazy. I am not at a point where I am willing to take any medication for it. Not that I would be allowed to take or be given any osteoporosis medication, because I technically, according to the medical field, technically I don't have osteoporosis. So I would not be able to be prescribed any medication for osteoporosis, but that is almost beside the point because I would have declined it anyway. So what I'm doing is I'm researching like crazy to find every exercise, every nutrition path, everything that I could do within my power to get my body to absorb the calcium for my density of my bones to strengthen through different kinds of exercises. But that sort of ties into my goal of losing the regain and then continuing down, because my goal weight has always been 150. 170 is 20 full pounds away from that. So I'm already really focusing on my diet and focusing on the exercise for the osteoporosis. And so I'm kind of tying the two together. So what I'm doing at this point is I'm exercising 3 to 4 days per week, 3 days a week at work. Before, like, I've done some videos doing the stairs. I've been doing the stairs. I now have a new technique of doing the stairs where it's more impact on my spine. And I have found this great YouTube, it's a channel, but it's really like, it's like this Bone Institute. It's like a physical place that they also create videos. So I've been watching those videos like crazy about building up the bone density through exercise. And so the main thing with osteoporosis is to have some impact on the bones. And so my main issue, my worst spot, is my spine. And so I've learned different ways to do the stairs. I've learned different exercises I can do on my own. I'm going to be doing those like crazy, because when I was talking to the doctor, because I have so many issues, so I see an endocrinologist because I've got blood sugar issues. And I had a type 2 diabetes diagnosis, which I no longer have. Now I'm considered pre-diabetic, even though it's just because apparently they're kind of forced to keep something on my record. I have impaired fasting glucose. A lot of us have the same sort of weird diagnoses that they're kind of compounded from other disorders we have. It's kind of like a domino effect, and that is one of them. But he basically told me, so I've been seeing him for about like eight years or so. He told me that that I'm not in a critical phase with my osteoporosis right now. I'm not at risk for fracture, except for the fact that I've been having back pain, and so he has prescribed, has sent me off I'm going to get some x-rays in my spine. But what he said is he's actually more worried about when I hit my late 50s and 60s. So, and I even told him, I was like, you realize that most people coming in for osteoporosis, they're more worried about their 80s or 90s, and I'm worried about my late 50s and 60s. And so he said, yeah, that was basically, I have a head start, unfortunately, on the osteoporosis train, I guess. So yes, it's major rug pulled out from under me. Yes, it sucks so badly, but I am very, very grateful that if I had not had the weight loss surgery, I would not have been having 1 year labs done, and I would not have been prescribed a DEXA scan, and I would not have found out that I have this potentially debilitating disorder. I would not have found out until maybe I broke my back or broke a hip or broke some bone. And that could have been 20 years from now. I don't know. But I feel fortunate that I found out now. I could be very, very proactive. My mother also has osteoporosis, and she's going through medication, and she's trying to do all that. Well, I feel very, very fortunate. And the doctor even told me that he said it's really rare for women my age to get the diagnosis, because it's very rare for them to even be sent to get the test. The DEXA scan is not a standard test for the average woman. So, and my life situation, my weight loss surgery had zero to do with any of this. I would have had this anyway. Oh, and another issue is the fact that I've got such severe acid reflux and GERD, and I've got the hiatal hernia and a Barrett's esophagus, which is precancer of the esophagus caused directly from GERD or acid reflux. And so acid reflux medication also inhibits the body's ability to absorb and utilize the calcium that comes into the body. And my vitamin D levels have been low. Now, if you're not familiar with vitamin D, it's very important to have your vitamin D levels checked and on point, because vitamin D is what allows, basically, it's sort of like, it's kind of like the co-worker of all the different minerals and vitamins. And so we need the vitamin D level up so that we can get the calcium to be absorbed, so we get the other vitamins and nutrients that we take, because we take all these, multivitamins and post-op, like the bariatric vitamins, and we take the calcium pills. Well, we need that vitamin D to be up there too in order for our bodies to absorb it. So they're really watching my vitamin D level as well. But so far that's going pretty good. So I just kind of wanted to let you guys know that I'm really fighting this. I'm not taking it lying down by any means. I have a really positive outlook. I'm really, like I said, I'm blessed to have the diagnosis. And in a couple minutes, I'm going to do a video. I'm going to bring in my daughter, and we're going to talk about her pre-op diet. I have a lot of new subscribers, and not everybody. And I so love my loyal gals that are just like always there for me. Thank you so much. And you gals, you know who you are. The ones that are always commenting, encouraging, I can't even tell you how much that means to me. But there's like this whole new group of ladies and men starting in this process. And so I want to just use whatever knowledge I have to be able to kind of share what I've learned and share this new journey I'm taking with my daughter, because she's having a completely different surgery than I had. And she also has some other different circumstances. Not only is she only 21 years old, but she also is bipolar. And so that really is a big factor, you know, with all of this. So anyway, I'm gonna let you go. I'm gonna do another video with my daughter in a few minutes. If you want to like hang around and watch that one too, that would be so awesome. And she could really use some encouragement. Her surgery is tomorrow, 7:30 in the morning, California time. Prayers would be so welcome. But I will do another video with her in a few minutes. Okay? Thanks, you guys. You're awesome. See you later. Bye.